Okay, good afternoon, everyone. My name is Rachel Sporletter. I'm the benefits team lead here. I've been here just about 5.5 years, and we thought that it would be a great idea with some of the changes in the biometric screenings and the well-written requirements to host a webinar to kind of go over what changes are happening for this year. Just as a side note too, if you do have any questions, feel free to throw those in the chat, or there's also a Q&A. You can throw those questions in. So welcome to Preventative Care is the Best Medicine. The agenda for today's meeting, we are going to discuss why the WellRate exists, how to schedule an appointment with the wellness clinic, how to use that Navigate portal, and then we'll go into a Q&A. All right, so why wellness? We actually get this question a lot in our office. The biggest reason is to put your health first. We know everyone has dealt with the situation where it's like, hey, work is so busy, I can't do this, I can't get away. We really need to be kind of putting ourselves and our health first. So that's the main reason why we do it. Knowing your numbers. Knowing what your actual biometric results are and understanding what those numbers mean, that's a big reason for the change this year. So knowing your numbers and not just knowing them, but understanding them and knowing what you can do to enhance and improve those numbers. A main other reason that we do it is we are a self-funded medical plan. So that truly means that we are trying to be wise when paying out those claims and when seeking care, and then therefore minimizing claims. As we all have heard and know, early detection and prevention is key. So that's why we're putting on this presentation, and that's why we push for these biometrics done annually. And I just thought that baby is cute, trying to eat healthy. All right, so a few myths. I've done some of these meetings with departments individually, and I'm getting a lot of questions about this. So I thought I would put together a slide just on like, did you know? For instance, I am shocked to learn how many people thought that they can actually fail this program. So did you know that you cannot fail this program? It doesn't matter what your numbers are and where you fall in those ranges, you cannot fail the program. None of your individual results will ever be shared with us. Anything that's shared with us is department or company wide. So it is a very broad sharing aspect. There's a certain percentage that we cannot get down to. So for instance, human resources departments, we are too small. We can't run a report on us to see how HR is doing, but sheriff's office, they're much larger, or human services. They are the bigger departments where we can actually see department-wide how the group is doing. But anything on a smaller or individual scale, we cannot receive that data due to HIPAA. That also comes into play. Some people will send me their form, like, hey, can you upload this for me? And I cannot see anyone's individual form, again, due to HIPAA. So, and then dependent children. Our dependent children are not eligible for the wellness rate. Of course, they can be covered on our medical plan, but they are not eligible to earn an additional discount. And then speaking of discounts, our spouses. Our spouses are the only dependents that can earn us that discount, and they can double our discount if they're covered on our medical plan. So if your spouse is covered on your medical plan, they can double your discount. They're not tied together either. So if you earn the discount and your spouse doesn't, you get your discount. If you guys both get it, great. It equals $80 a month or $40 per paycheck. It's a lot. And then if you are new to the plan because you lost other coverage, or perhaps you're covered on your spouse's plan and your spouse lost their job and you're moving over, any time you're moving onto the plan and new, even at open enrollment, you will automatically qualify for the discount. The only time that that doesn't apply is with new hires. So, and then physician's form. If you have a physician's form, that can be completed at any annual exam. So you don't have to have a specific biometric screening. For instance, if you go in for your annual exam every year in August, go ahead, get that done, have those biometrics done, have that form completed. You don't need an additional exam just for the biometric screening. Just make sure you get that form completed and signed. And then there is a look back period for all of the criteria that we have. And that look back period is all the way back to October 1st of 2023. So the plan ends September 30th. This plan starts October 1st. So there's no kind of gap there. So for instance, if you had a flu shot done in one of our county sponsored events in October of 2023, great, get into that Navigate system and log those numbers, log those preventions. If you had one on September 15th of last year, unfortunately, that won't qualify. You'll have to choose another exam. The other thing that I like to mention here is that you can't choose two of the same exams. I get a lot, hey, I had 2 dental exams. Can I do 2 of the same thing? And you cannot. I know I'm running through here, but if you guys have any questions, feel free to throw them in the chat. All right, the wellness clinic. Marathon Health is actually the vendor who runs our clinic. So you'll hear it referred to as Marathon Health and potentially the wellness clinic as well. Book a biometric screening now. Get on their schedule. You can do that online. I've got their online website linked right here. Call or text the main number there. So if you're looking to schedule an appointment and don't want to play the game of, you called and no one answered type thing, go ahead and just text that number and say you want to get scheduled for a screening. Remember to use clinic leave on your time card. This is eligible for clinic leave. The clinic opens at 7 a.m. Monday, Wednesday, Friday, and 8:30 on Tuesdays and Thursdays. They are quick 10-minute appointments. So unless you work it in with another appointment that you're having at the clinic, you should be in and out of there in about 10 minutes. These appointments that if you just request a biometric screening, it is going to be venipuncture. So keep that in mind. If you are someone like me who would rather have the finger stick, you have to make sure to ask for it, or else you're just going to have the normal venipuncture. There is conflicting information about fasting appointments. On the Marathon website, when you go to make an appointment, it will tell you it's non-fasting. They are fasting appointments. Please do not go non-fasting. You can have the exam done non-fasting. However, all of your numbers are going to be askew. So it's better to have it done when you're fasting. So disregard that message on the Marathon Health portal. We've tried to get it removed, but it's hard coded on there. And then regardless of what medical plan you're on, there are no charge for these appointments. So make sure that you don't pay anything going into the clinic for these appointments. And then something new that we have this year is that we have set up a file feed between Marathon and Navigate. So monthly, around the 10th of the month, a file is sent for the previous month's biometrics that were performed. And then Navigate is kind of scrubbing through that file, cleaning it up, and then uploading your results into the portal. So for example, if you had your screening done this month, the month of April, around May 10th, the file will go from Marathon over to Navigate, and we give it till about the 20th for those results to post in the system. All right, any questions on the clinic? Okay, here's some screenshots on how to schedule an appointment on Marathon Health's website. Keep in mind that if you go to log in, or let's just say if you don't have a login, reach out to the clinic. They're the ones that manage that. Again, due to HIPAA, we can't see any of that. So reach out to them and they'll be able to help you. But this is the main page here at the clinic. So you'll go straight into the clinic. How can we help you today? Schedule an appointment is right there on the main page. So you'll click on that. It will take you to a page that asks, what's the reason for your visit? You can choose here what exactly you want to be seen for. Obviously, biometric wellness screening is one of the hot topics there. This is going to direct you to an in-person visit since it is blood work. If it was something which was sick or health coaching, potentially it could be virtual, and that option would show here as well. But for this, it's just going to show in person, and we're going to choose search results or search availability. Sorry. I took this screenshot last Friday. So you can see that availability is out here and is relatively quick. So this is coming up on Thursday, the 25th. And here's all the different times that are available for you to make an appointment. If this time didn't work for you, or if you were like, I am not waiting until 9:30 to have my morning coffee, click on this search next available day and it'll give you lots more options there. I just got a Q&A that I'm going to look at. I get confused between the wellness rate and the wellness program. Is the rate part of the program? The term wellness program is very broad to me. If you could give me a little bit more details, I will show the criteria card in here on what you have to earn for the rate. But we have a lot of wellness programs that we offer. So if you want to give me a little bit more details on what you mean by the wellness program, I'm happy to answer that. All right, and to click on through, oh, here's that wellness rate criteria card that I was talking about. So this is a great resource. If you go to the clinic, they have these cards there. Anyone interested in any of these cards, please let me know. I've got a big box in my office that I like to distribute. I will tell you, when I went in for my screening, I was literally looking at this. I'm like, okay, here's the criteria that I need to meet. So I kind of knew walking in the door where, based on my numbers, where I was at. So item number 1 here is completing that biometric screening. Again, you can do that with your own physician. You can do that at the clinic. And then if you do that with your own physician, step number 2 is uploading that into that Navigate portal. Once you upload that, it takes normally about 10 days in order for that in order for your results to post into the system. And that's where number 3 comes in. These are your results. So these are the criteria. If you meet 3 of the 5, this item is marked as complete. But let's say you went out for a cheeseburger and some beers the night before, forgetting about your appointment, and you get in here and you were like, shoot, I missed more than 3. That means some alternate courses will now come up in Navigate, where you will go through and complete some courses around the items in which you missed the criteria. Number 4 here, you're going to want to self-report if you're a tobacco or non-tobacco user. Again, these details don't get back to us. I've heard from people that they think that their rate is going to increase if they say they are a tobacco user. That it is not how this works, other than earning or not earning the discounted medical premiums. And then number 5 is completing a well rate survey. I say that this is like one of those lifestyle quizzes where they ask if you like text and drive, or they ask, how many vegetables you eat, what your lifestyle is like. And how the Navigate portal works is how you answer those questions, is how the challenges actually come up for you. So it's specific to you and how you run your lifestyle, basically. Again, none of this stuff comes back to us, so it doesn't really matter how you answer them. And then logging those 2 preventive care screenings. Now, keep in mind, you'll see here on items 4, 5, and 6, there's a little asterisk. That asterisk really means it's only for us employees that have to complete that. Our spouses on our plan, they have to complete a screening, upload the form if they don't go to the clinic, and then meeting 3 of the 5 or completing those alternate courses. All right, I have another Q&A in here. Completed my wellness screening on 3/25, but haven't seen the completed and navigate yet. How long should I wait to reach out to make sure all my data gets logged? Correct. I'm assuming that you had your screening done at the clinic. I did get an email earlier this morning that there's an issue with the file that Navigate and Marathon are working on. So hang tight on that one just a little bit more. This is unusual and not normally how it works. This is our second file. So that is why I'm hoping that's not the case for all future files, but that's what's going on right now. All right, sorry about that. The biggest thing here to remember too is that deadline. That deadline is September 30th. This is for everyone. And there's no exceptions on this deadline. So please, 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 if you have questions as to whether one is going to qualify or not, or if you have questions regarding your form or the program, or just like that question I just got, where it's like, hey, this is in the system, please reach out. We are happy to answer those questions. All right, how to access the Navigate portal. So for anyone who opened and read that email that went out earlier this week from Navigate, they are working on another MFA, multi-factor authentication. So right now, if you try to go in, you're going to have to complete that. Our ITs are talking, hoping to get that removed since we already have that through Okta. More to come on that. I apologize. I got a tickle in my throat and can't get rid of it. All right. So how to log in for us as employees. You want to go into Okta, and then you will just click on Navigate Wellbeing. You can also go to larimerwellbeing.com and log in that way. If you do the website, you will have to actually log in and not kind of go through Okta where you don't have to remember passwords, which is great. It will ask your unique ID. Your unique ID is your full digit employee number. Pardon me just a second. I'm going to go grab a cough drop. Any other questions that I can answer right now? And for the anonymous attendee that asked about the wellness program, more information I am happy to answer. How is it possible not to fail if I don't meet 3 of the 5 criteria? This is a great question. I am going to answer this question in 3 slides. Hold that 1 second. But here is how, excuse me, us as employees can log in. Here's how our spouses log in. This one's a little bit more important this year, how our spouses log in, because we don't have the catapult file where it automatically goes over and it automatically marks us as complete. Spouses will log in on the same website, and they will only have the 2 criteria to meet: having the screening done and meeting the criteria. But how they log in, their unique ID is your UKG number with an S on the end. And if you need to know what your UKG number is, because I still don't know mine, if you log into UKG, at the very top in the tab, it'll tell you your ID. Then I have a screenshot here of an employee who is complete. They've completed the 2024 Larimer County Medical Plan for the 2025 wellness rate. You'll see everything here is marked as complete and the points are loaded here. Now, for your question about how is it possible not to fail if you have to meet 3 of the 5 criteria, this is how you meet it. This guy, this was a sample guy too, by the way. But he's got high blood pressure. His blood glucose is double what the normal range should be. Waist circumference is big. Triglycerides are high. You can see here under all of these items, these are red, which means he's a high risk factor. And then there's an alternative here. This is an actual course. So if I was on the portal, I could click on this, watch this course that tells me how to manage my blood pressure. What foods I'm eating might increase that. What foods I'm eating that could decrease that. As soon as that course is completed, this will be a green checkbox and boom, you're done with that course. As soon as you have the courses completed in which you didn't meet the criteria, this will then change to complete, as you saw on this slide here, and you'll have 200 points of the 200 that you need. Those courses will only show up if you haven't met 3 of the 5 criteria. If my spouse gets their screening at the clinic, does that get automatically uploaded into the system? Yes, it does. So they will go over on the file feed as well. They will still need to go in. Again, if they didn't meet the criteria, they'll still need to go in and complete these alternate courses if they didn't meet that. But yes, they will go over on the file where the biometric screening will be marked as complete. And then these alternate courses will then come up. But this is the biggest change. And this is the reason why we're doing this. With Catapult changing their model, we really needed a way for people to kind of get their results and know what they mean. I did my screening on a Friday at the clinic. By the way, you'll get an email from LabCorp normally the next day with your results. It gives you the scale. It tells you what your numbers are. I have no idea what these numbers mean. So I went down the Google path of Googling everything. I did get an email from Katie on Monday saying like what some of my results meant and what I can do about them. So, but know that you will get an email from LabCorp with your results, most likely before the clinic. But yeah, great questions. We are also starting targeted emails, and we're going to do more targeted emails directly from Navigate. So once this marathon file loads, we're actually going to run a file for those spouses who have met the criteria, have had the biometric screening, but haven't met the criteria, because we want to make sure that they don't miss this. Here is a screenshot of our preventive care and everything that qualifies as a preventive care. You do need 2. And like I said earlier, you need 2 different services. Some things that I like to highlight here is there's also a hearing exam that we added earlier. So if you have a hearing exam done, mark that off. You have physical therapy done, mark that off. Behavioral health visit, there's some of the normal items, right, for preventive care. But behavioral health counseling, therapy appointment, physical therapy, hearing exam, and blood drive donation are relatively new for us. Keep in mind that look back period is back to October 1st. So I think last time I looked, we're about 500 employees who were already completed with the program, all in all. So I recommend going and getting in there and getting everything done so you don't have to worry about it come September. As you might imagine, the clinic gets very busy in September. It's basically all they're doing. So if you're on the plan now, just get in there and get it done. So next steps, as I mentioned, log in to Navigate, see if you can complete those other things. That lifestyle quiz is a real easy thing to just get in and get done. The tobacco, get in there. Even if you are a tobacco user, you hit yes. It tells you that there's resources available. If and when you're ready to quit, boom, done. Points load automatically. And then if your spouse is on the plan, have them log in and check their email address in their profile. A lot of them are the generic, it's info@navigatewell.com. But if that's the only thing that's in there, they're not going to get those emails. We are going to email employees too, because I know that this affects your premiums, right? So that is our takeaways from here. So log into Navigate, get those things done, log into Marathon Health or text to get that screening scheduled, or for your spouse. Verify your spouse's email and don't miss that deadline. That September 30th deadline is hard deadline. All right. That is the end of the presentation. I went through that pretty fast. Sorry, guys. What other questions do you have? Sorry, I'm opening back up the Q&A. I don't see any questions in there. And I don't see any questions in the chat. Anyone have any questions? Nothing. Oops, I see another one. Are you able to explain the massage reimbursement situation? I'm hoping that you mean just how massage reimbursements work through our medical plan. Everyone has $1,000 bucket, everyone who's covered on our medical plan. So even your young kiddos, if they're covered on our medical plan, they have $1,000 bucket for massage, acupuncture, and sensory deprivation. That is per calendar year too. So everything starts over January 1st. Massage therapist, there's not a lot of them other than Height of Health that will run your claim through insurance directly. There also doesn't need to be, and they don't need to be in network with Aetna. They can run through and you will be reimbursed everything minus your $25 copay if you're on a PPO plan, if you're on a high deductible, if you're on the high deductible plan, you pay 100% of that until you reach your annual deductible, which for 2024 is $3,200. But you can use your massages to get up to your deductible too, should you want to do that. And Crystal asked about the HSA. I'm guessing you mean with the massages? Yes, you can do, oh, you said HDHP, sorry. Okay, I see that. So yes, high deductible members are allowed to do that and run them through insurance. However, it doesn't really cover anything until you've met that deductible. Does it cover chiropractic care? So Renee, chiropractic care is actually run through the medical plan and they do have to be in network. We used to have one bucket for acupuncture, massage, and chiropractic, but that ended back in, I believe it was January of 2019. It could have been 2020 as well, because the Colorado state said we can't put a limit on our chiropractic care. So chiropractic care does need to be in network. It is still a $25 copay for those on a PPO plan, and you can see whoever in network that you want. All right, I see another one here, not necessarily a preventive question. Why is the wellness center out of network for the HDHP? This affects my deductible since it goes out of network deductible and not in network. I thought we had that corrected. It is in network. Last year, they were running as out of network and we got that changed. So I'm hoping that this was an old situation. If not, please email me and let me know, because we updated this last year to get them in network. Because you're right. It was weird that it was going to out of network when obviously they're in network. So let me know if this was a recent claim and we'll get it adjusted, because I am happy to get that adjusted. There's no reason for it to be going out of network. Great question. Okay, I see another one. Okay. I noticed HDHP does get the perks like the other programs. Is that because Larimer pays into the HSA? Does not get all the perks. Okay, all right. So HDHP is its own wheelhouse. The IRS does not allow us to have first dollar coverage, any provider. any plan member doesn't have first dollar coverage. And so that means copays. So you have to pay 100% of any plan until you reach your deductible, unless it's preventive care. So that is IRS regulation. It doesn't have anything to do with us. That is why we add into the HSA to kind of combat that a little bit. But keep in mind that is not a Larimer County thing. That is an IRS regulation that we have to abide by. Just new to you. Yep. There's a lot of people who this plan is new to. Just, the biggest thing that I like to tell people is you're paying 100% of everything until you reach that deductible, which is it's the lowest high deductible that we can offer too. So that was another thing that we were able to do as Larimer County, is we kept that as low as possible. But yeah, great questions. What else can I answer for you guys? No other questions? Well, thank you again for joining. I will get those Nectar points awarded, and we will get the recording sent out to you hopefully by tomorrow. Please let me know. Again, I'm here if you guys need questions, or if you have something that might be a little bit more individual that you didn't want to bring up on a topic or on a webinar like this. Please feel free to reach out, and have a great day. I'll give you about 12 minutes back. Thanks, everyone. Take care.